Welcome to the fourth installment on the How to Use Anki Effectively series. My name is Nikolai and I am a fourth-year medical student at University of Guadalajara in Guadalajara, Mexico. In this specific video, we're going to talk just about one very important thing: how to personalize and modify the workload, the number of new cards and review cards, so it can better match your studying rhythm. This is very important. You have to pay a lot of attention, and if you have any doubts, don't hesitate to contact us in the Valedictorian MD website or check out the other resources we have for you. So let's get started. As seen before, the workload is very important in Anki because it is going to determine not only the number of new cards you're going to do a day, but also the number of reviews you're going to do in the long run. So if you increase the number of new cards, there's also going to be a proportional increase in the number of review cards that you're going to see in weeks or months time. So very careful with that. As I said before, a increase or decrease in the number of new cards you're going to do a day is not going to decrease the number of review cards, but it's going to decrease the slope of the increase in review cards. So a few new cards a day, it's going to reduce the number of the increase in review cards you're going to do, and an increase in the new card number is going to increase also the slope of the increase in the review card. So keep that in mind, pay attention to this slide, it's very important. So the question arises, how do I modify this? We as valedictorian are already telling you that this is important, but we haven't in 3 videos explained to you how you can really modify this and how you can save yourself from doing 1,000 review cards a day. So that's what I'm going to show you now. You can do this in a very easy manner. So you enter Anki by clicking on the shortcut on your desktop. It's going to open the Anki interface and it's going to show you the different decks that you have available. So I want you to focus on the deck that says Anki on your slide, and there's a button on the right side that is a green thing. For you, it's going to appear as a gear icon. You can click on that. Localize the deck you want to review. You're going to see, most likely in your case, you're only going to see the Anki deck if you've been following our videos. By this, I want you to see that there is a green button on the side. For you, most likely it's going to be a gear icon. We're going to talk about that later. But before, I wanted to give you a quick tip, valedictorian tip. If you go to the plus option, or to the plus button on the left side of the Anki's deck, it's going to expand the deck and you're going to see a lot of subdecks. These subdecks are specific for specific topics. If you want to study only pharmacology, there's a topic for pharmacology. If you want to study only cardiovascular disease, there's a specific subdeck only for cardiovascular disease. So you can tweak and personalize the way you're studying by specifically choosing those options and doing what I'm going to tell you now for this specific subdecks. So I highly recommend this because it's going to allow you to complement your first stage studying with Anki, and you can follow through with a specific deck for that subject. So check this out, see if it works. If not, please contact us so we can help you out. Going back to the workload thing. So on the right side of the Anki deck, you're going to see a gear icon. And if you press it and you select options, you're going to be prompted this new window. This window has many tabs. You can see in the upper part, one says new cards, one says reviews, and you can forget the rest for now. In the new card option, in the new card tab, you're going to see that the second option says new cards and a space with a number. You can change this number. As said in previous slides, if you modify this and you go up from new cards, you're going to see a lot of new cards, and then a lot of learning cards, and then a lot of review cards. If you keep this number low, you're going to see, well, a low number of new cards, a low number of review cards, and a moderatively high number of review cards. So keep that in mind. By changing this, you're basically tweaking Anki to show you only a specific number of cards per day, and this is really going to help you to personalize the way you use Anki for the USMLE steps. And if you go to the second tab, which is reviews, you can change and you can add a max number of reviews you want to do. This does not mean that you're doing all the reviews you are due, but it can be very helpful if you're loaded with cards, if you don't want to continue studying, and if you want to reach a center endpoint for the day, you can set a maximal number of review cards that are going to be shown to you on that day. I want you to remember that this does not mean that you're finished with your review cards. It only means that only a specific number of review cards are going to be shown to you on that day. So this is very important, because if you keep it low, it may seem as you're finishing all your cards, but you're actually only maintaining a fictional number of review cards low, but actually you're overdue with the cards, and you will have a lot of cards accumulated. So my specific recommendation is to keep it as high as possible, so you can do all of your review cards every day. An important thing for now, leave the rest as is. The rest of the options, both in the new tab and the review tab, are useful if you understand the way that Anki works in a really primal manner. As you don't, because you're watching these videos, you just keep it as is, don't change anything. The program is almost perfect as is. Only change the number of new cards and review cards you're going to do a day. Well, that's it for this video. Again, if you want to learn more about Anki, you can go to the Anki subreddit in Medical School Anki, or you can check the Anki in YouTube, or you can also check the valedictorian in the website for the rest of this series and other very valuable resources that are going to help you out through your USMLE journey.